Does poverty worsen schizophrenia outcomes? When we think about schizophrenia, we often focus on the symptoms and treatments. But what about the role of poverty? Does being in a tough financial situation make things worse for those living with schizophrenia? Let's break it down. Schizophrenia is a long-term mental health condition that affects how someone thinks, feels, and behaves. People may experience hallucinations, delusions, or disorganized thoughts. The causes are not fully clear, but a mix of genetics, environment, and brain chemistry plays a part. On the other hand, poverty means not having enough money to meet basic needs like food, shelter, and health care. Living in poverty can lead to stress, poor living conditions, and social isolation. Research indicates that poverty can worsen outcomes for those with schizophrenia. For starters, living in poverty can increase stress levels. High stress can trigger or worsen psychotic episodes. When someone is struggling to find stable housing or access nutritious food, their mental health can suffer. Access to health care is another major concern. People in poverty often cannot afford mental health services. This can lead to delays in diagnosis and treatment. Without proper care, managing schizophrenia becomes much harder. Social isolation is also a significant issue. Many individuals with schizophrenia need social support to manage their condition. However, poverty can cut people off from their communities, making them feel more alone. This isolation can worsen symptoms and lower the quality of life. Cognitive ability may also play a role in how poverty affects mental health. Some studies suggest that when cognitive ability is considered, the negative impact of poverty on schizophrenia outcomes is lessened. This means that cognitive factors might influence how poverty affects mental health. Moreover, living in a community with high inequality can increase stress. Feelings of injustice and exclusion can contribute to the worsening of schizophrenia symptoms. Understanding how poverty impacts schizophrenia outcomes is essential. It highlights the need for solutions that address both economic and health care needs. Policies aimed at reducing poverty and improving access to mental health services can make a difference. By providing social support networks, we can help those with schizophrenia lead better lives. Addressing these socioeconomic factors may improve long-term outcomes for individuals living with this condition.